we want to give our doctor a chance to also to make some remarks so that we can get to hear his feedback and his experience with the boys. Dr. Maurice, karibu.
Parents and guardians and my friends, they are called young men now. Good afternoon. My name is Maurice. I was responsible for inflicting some pain, as has been said. But was it too much pain? If I'm not wrong, all the men in the house are circumcised now. Is it true? All the men in the house are circumcised now. Unless kama kuna wale wamekuja kuchukua wenzao, the young boys, au tunawangojea hapo mbele. So, first I want to thank the Allsmiles fraternity for giving us this chance to transition these boys to the next stage of life. And two, I want to thank the parents, guardians, friends and relatives who are here to support the boys and give them a chance to have this experience of transition to the next level. Most of the boys are going to the next, I think, high school, right? How many are going to high school? High school. Yeah, it's quite a number. This one marks the beginning of change in their life going forward, because in the next month or so, they'll be having another change. And what they have been taught, I want to urge them not to forget. Are we okay? Young men, what you have been taught for this time that we've been around, please don't forget. Make sure you carry it forward with you, and it will shape your life going forward. Sasa, what I want to encourage the parents and the guardians who are going to stay with them at home, they have not healed. I want us to agree. They have not healed completely. Now, when they go home, I want us to observe three things. One, they should stay calm for the next 2 weeks. Hawatakuwa na uchungu, hawana uchungu sahi. Si ni kweli hamna uchungu sahi? Kama iko ni kidogo kidogo. The reason why I'm saying so, pain is in the mind. That's the truth. It starts from the mind. Actually, the pain that we inflicted, what we inflict, it was just a small pain for injection, so that area numbs, so that when they are cut and sutured and what, they don't feel pain. But then afterwards, there is some pain that comes with the wearing off of the anesthesia, but is managed by pain relievers. Okay? So the way we did it, all the risks are mitigated. So the boys, I've been with them. I think every 2 days I was coming to check on them, and I can assure you, there is no doubt they have done well for the time they've been around since we did the procedure. So the procedure was safe. We thank God. It didn't have any major issues so far, and I can confidently say the boys are okay as they go home. So the boys will have to stay at home, cheza na PS in the meantime. There is no riding bicycles. Those ones who game, hakuna basketball. Sema tutacheza basketball, ni nani? So there is no playing football, no basketball, no athletics. Hizo za kuruka na kukimbia in the meantime for the next 2 weeks. So parents, please support them on that. We want them to heal completely, wasikwe na issues. Sawa. Secondly, about diet. Tumeambiwa sasa tumetairiwa, sasa ni kukula maini na kuku. There is no special diet for this. Ni injury tu, kama vile unaweza katwa mali kwa mguu labda ukicheza. Do you really have to change diet for that? Yes, it's just a small injury like any other. Isn't it that it affects the special area, si ndio? So whatever mom cooks is what you will take. Sawa? So to the parents, in case there is a problem, because kuna ile inaweza tokea after, si ndio? I would like you to keep in touch with me. I'll give you technical advice on how to go about it. I want all the boys to heal vizuri without any problems. Na kama iko, please usimpeleke kwa daktari mwingine, because I know there are those extortionists are also there waiting. Some of them are there to make use of your ile kutojua what's happening. I like following up my patients and make sure they are okay. Kama kuna element itanishinda kuhandle which I have not seen so far, there is a way of referral, and I refer to persons that I know can handle the issue. Wengine utampelekea tunaanza kucomplicate hiyo issue even further, just because ameona labda parent ako na kadi ama anakaa anaweza toa kitu hivi. Sawa, so make sure you call back. I'll give a technical advice. Sawa. So as you go home, the parents, I think so far so good, and most likely you'll be satisfied with the work that we did. We did it slowly, confidently, and we did it well to the best of our capacity for Allsmiles boys that are now young men. So next time you can spread the gospel outside. Waambie wengine, my boy was there, akafanyiwa hivi, akafanyiwa vizuri, alipona vizuri, didn't see any complications. Let more come so that they can be done the right way. The way we have done. Tulikuwa na WhatsApp a virtual meeting sometime before we started this, and I think there were so many questions kwa nauliza. So in case there is any more that maybe you didn't get the forum for asking, Allsmiles, you can share my number. I have no problem with that. We can share information. Kama kuna maswali ngumu you can ask, but pertaining circumcision, kama ni traditional or the other one, kwa napata maswali ngumu kidogo, but I know I can do the traditional one vizuri. I think there is one and he's done very well, and I did it myself, so that one is sorted. Now lastly, to Allsmiles, I want to encourage you to do more of this, because there is a lot that goes outside there in our society. Kuna mambo mengi yanaendelea, especially for hizi generation yenye natufuata hapa nyuma. There is a lot, and if we don't give them the right direction now, we don't know how they will end. Sindio? Yeah, so I want to encourage Allsmiles to continue doing the good job you are doing, shaping the lives of these young boys and girls. And I wish you well in your endeavors in the course of the year. And going forward, these boys waelimisha na wengine ili vitu mmefundishwa, si ndio? Kuna wengine wakupata opportunity, some didn't get opportunity to get to like camp like this, to learn so many other things about the life shaping. Life shaping going forward. So good boys, you can share the information that you've been taught here, so that wengine pia wafanye nini? Wajue. Sawa? Don't keep good information to yourself. That's being selfish. Tumeambiwa should be sharing. Yes, even Jesus shared all that he could share during the time he was with us around. Okay? So don't keep good information to yourselves. Sawa? So now this one goes to the boys. You've been taught to be good boys, good men going forward. Okay? Kama kuna issue you cannot decide on yourself, there is someone you can ask. Ambaye ni nani? Parent or teacher or sometimes friends. Sindio? Umefunzwa hesabu lakini umepoteza formula kidogo, you can ask a friend. Don't fear asking. Umeelewa? Kama kuna kitu hauelewi unafanya nini? Unauliza and will be utaelezwa vile kunaenda. Okay? So we want you to have expanded minds. You are going to know more where you are going. Kuna wale wanajoin junior high school, junior secondary. But those ones who are going to Form 1, I wish you well in your endeavors going forward. I want to see good leaders from you guys. Sindio? Kesho tuambiwe huyu amekuwa MD wa fulani. Even a president can come from you guys. Sindio? In 30 years to come, 25 wapo, you can get one of us. Aseme, ukisema ni mimi, I'll vote for you. Because I know you are a good boy. Sawa? So, I would like to pass my it's called gratitude from my colleagues wenye tulikuwa na wao. Hata mmoja ndio ananikola pesa hii. Alisema nikikuja niambie vijana wakuwe vijana wazuri going forward, and they wish you well, na muendelee msome mkue watu wazuri, mjue mingi so that you can shape our world. So thank you very much for this, and I hope tungekuwa na ingine next week. It's nice. All smiles, congratulations. Thank you.
Thank you. So I think initially when we had the first meeting there were many questions. Inakaa sahi wazazi hawana maswali mingi. But I wanted to ask daktari whether vijana wanafaa kuoga. You know, I've noticed at this age people are usually anti-water. Water is they become allergic to water. Are they supposed to take a shower normally, or what should they do?
Hata si tulisumbua na kuoga at these ages. But I didn't talk about it because they have gone back to normal like vile walikuwa before circumcision. Nothing hakuna change as at now. Hata kuna mwingine alikuwa ananiambia naweza oga na shower hapa nje tu. When I came in, sema kwani unaoganga? Kuoga ni kawaida now. Actually the restriction was that when they still have the bandages, because wakioga maji natoka chafu kwa mwili, it can get to the bandage because it will soak, and there is some wound underneath, it can cause infections. Ndio. Bandage ikishatolewa you are free because there won't be something to soak with the dirty water. Sawa? So vijana tufanye nini? Tuoge.
Meskia, so you don't have a pass not to shower. Okay? Is there anyone, maybe if there's a parent who has a question especially concerning healing, maybe you have a question. Okay.
Sabuni kishika hiyo place.
Oh, he's asking. Just say your name. No, these are now the confident boys that are men now, right?
My name is Mabri Mali. What if the soap touches that place?
Oh, you have another one? Yes. Okay.
My name is Charles. What happens when soap gets on the thing?
You also have a question? There's another one. Give the mic behind there.
My name is Kak. How long is the healing process?
So I may answer these questions quickly. One is about the soap. At sabuni ikiendea hapo, what happens? There's no problem. Inapitia hapo ikipita wakati unaoga, si ndio? It does not stay there. So we oga. Sawa? Number 2 ni, what did you ask? I didn't hear it. Yeah. The same question. Are you answered? Now, about the healing process, how long does it take? All of us here, if we are subjected to the same injury, we will heal differently. So, healing depends from person to person. Some of us will heal mapema, wengine tutakakaa kidogo, wengine tutapata sepsis, that is infection, kidogo delay, but eventually it will heal. Unless there is a special condition, which I don't think we had, for conditions that causes immune suppression, like HIV, those ones who are diabetic, and a few who have just chronic immune suppression syndrome. Wenye wakiguzwa na kitu kidogo, it takes time to heal. Otherwise, I didn't notice any on the boys because I've checked all of them. So healing process takes time and it differs from person to person. But in the next 1 or 2 weeks, everyone should have healed completely.
We also now want to give an opportunity to 5 parents. We want to give an opportunity to 5 parents. We want to have 3 male parents and 2 female. Hatutaki kukua, we do the 2/3 gender. Hatutaki kuenda against the law. So we want to get volunteers, parents 3, to come and make some remarks. You've interacted with your son. Maybe you tell us how you've also had sleepless nights, wondering whether your boy is safe, and then you tell us your experience briefly, like 5 minutes or so, and then we can proceed to the next agenda. Any 5 parents who are willing to make some remarks? All right, we have one.
Good afternoon. Good afternoon, parents. Good afternoon, boys. My friend, you are boys. This one we have to agree. Hamutaniamisha kwangu, I'm the man in that house. So good afternoon, boys. Okay, sorry. Good afternoon, young men. Thank you so much. My name is Mbalanya Job. I'm a father of, I don't know how many kids. I think I have 6 or 7. And I have 2 boys here. There's one, I think the youngest here is mine. And the other one, there's another ninja here. Yeah, there he is. So those are my 2 boys. I want to appreciate Allsmiles for the work that you've done. I was away, I would have come to witness the whole process. Actually witness their mother when he's delivering them. So I wanted to come and witness this, but I was away. And I truly appreciate the work that you've done. I've just been making calls, but I've seen them, they're okay. My only concern is what happens after this. Like, is there any medication they'll be given? They heal the hard way and the only way. The other thing is the stitches. Will they be removed? They'll come out. Because during our time, we had to go back to the hospital like 3 times for stitches to be removed. So those are my concerns. Otherwise, I truly appreciate it. Thank you so much.
So, if I respond to that, about medication, unless there is an absolute necessity to give antibiotics, the procedure, how we do it, it is sterile. It means we clean the place and it's done under a sterile condition. And I said, unless the boy has an established immunity issue, like who has uncontrolled HIV, we don't necessarily use antibiotics for that, and they heal well. The standard procedure from adopted by the WHO dictates that circumcision is supposed to be done under sterile procedure. That's what we do, and there is no need for using antibiotics, especially after the procedure, unless you doubt your condition of sterility. So the boys are healing well without antibiotics, and they'll heal like that. I've done so many. I lost the count, but they don't do the antibiotics. Unless there's someone who has an infection that actually warrants use of antibiotic, those are isolated cases. So the reason why we do reviews checking on how they are doing is to identify if there is need for use of antibiotic, and we give appropriately. The next one is on the stitches. The stitches that we use for circumcision are absorbable sutures. So they will come out themselves after some time. I think some of them have already lost some few. There are a few remaining, but they come out themselves. They are designed in a way that they come out after some time, and they leave the wound where they were applied already closed. Okay? So hizi hazitatolewa, they'll come out themselves. Sasa wa parents. Okay.